Chapter 16 of ICD-10-CM is for certain conditions originating in the perinatal period. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter P, which makes it easy to remember, P for perinatal. If you remember from ICD-9, these codes all started with the number 7. In ICD-9, this chapter followed the Congenital Anomalies chapter. In ICD-10, it was moved to follow the Pregnancy, Childbirth, and the Puerperium chapter. The perinatal period means before birth through the 28th day following birth. I want to stress that the codes in this chapter only go on the baby's record, never the mom's record. Though these codes go on the baby's record, they may still be used throughout the life of the patient if the condition is still present. For example, code P03.2 is for newborn suspected to be affected by forceps delivery. The forceps may have caused a head injury to the baby that is treated long after the perinatal period is over. If the condition is still being treated, it is still appropriate to use this code. You're going to use these codes when documentation indicates that maternal conditions either caused or had the potential to cause a complication in the baby. Unlike the majority of ICD-10 codes, codes from this chapter can be used for newborns that are suspected of having an abnormal condition resulting from exposure from the mother or the birth process, even if after exam and observation, it turns out the baby does not have the condition. Also, if a newborn has a condition that may be either due to the birth process or community acquired, and documentation does not indicate which it is, the default is due to the birth process, and the code from Chapter 16 should be used. Category Z38 is for live-born infants according to place of birth and type of delivery. A code from this category is used once for the newborn's record at the time of birth. If the baby is transferred after birth, Z38 is not used at the receiving hospital. Now I'd like to try an example. A pregnant woman in her late 3rd trimester sustains a complicated skull fracture during a car crash. As a result of her injuries, she goes into labor, and the newborn is delivered vaginally in the hospital in respiratory distress. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is Z38.00, single live-born infant, born in hospital, delivered vaginally. To locate this code, start at newborn in the alphabetic index, which has the words infant, live-born, and singleton in parentheses next to it. The next thing we need to look for is the phrase born in hospital, which points to Z38.00, which you would then confirm in the tabular. The next code is P22.9, respiratory distress of newborn, unspecified. To locate this code, start at distress in the alphabetic index, then find respiratory. Indented below this is the word newborn, which points to P22.9, which you would then confirm in the tabular. The last code is P00.5, newborn suspected to be affected by maternal injury. To locate this code, Start at newborn in the alphabetic index, then find the phrase affected by with suspected to be in parentheses next to it, and indented below this, see maternal. Indented below maternal is the word injury, which points to P00.5. Though documentation states that the mother was in a car crash, there is not an option for this indented below the word maternal, and injury is the closest we can get to this situation, as she went into labor as a result of her injuries. When you confirm P00.5 in the tabular, there is an instructional note under category P00 stating code first any current condition in newborn. Therefore, we know that P00.5 must follow the newborn respiratory distress code. Also, Z38.00 must go first, as the guidelines state that when coding the birth episode, a code from category Z38 must be the principal diagnosis. Categories P05 and P07 are for prematurity. These categories include codes for the baby's weight and gestational age. It is important to remember that a code for prematurity is only used if documentation states that the baby is premature. When both weight and gestational age are documented, you should use two codes from category P07. The birth weight should be sequenced before the gestational age. Now I'd like to try an example. An infant is born prematurely at 29 weeks gestation and weighs 710 grams. The physician assesses the infant as being extremely premature. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is P07.02. Extremely low birth weight newborn, 500 to 749 grams. Remember that the guidelines state that when both weight and gestational age are documented, weight should be sequenced first. To locate this code, start at the term low in the alphabetic index. From there, you would go to birth weight, then extreme, then 500 to 749 grams. Which points to P07.02, which you would then confirm in the tabular. The second code is P07.32, preterm newborn, gestational age 29 completed weeks. To locate this code, start at premature in the alphabetic index, then go to newborn, then less than 37 completed weeks. There is a note stating C preterm, newborn. After following these directions, indented under preterm, then newborn, is gestational age, followed by 29 completed weeks, which points to P07.32, which you would then confirm in the tabular. Code P95 is for stillbirth. This code is only to be used in institutions that maintain separate records for stillbirths. No other code should be used with P95, and it should not be used on the mother's record. She would have a code on her record from category Z37, such as Z37.1, single stillbirth, or Z37.3, twins, one liveborn, and one stillborn. Let's do another example for this chapter. We have a 9-day-old infant admitted for Staphylococcus aureus sepsis. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is P36.2, sepsis of newborn due to Staphylococcus aureus. To locate this code, you would start at sepsis in the alphabetic index and then go to newborn. Indented below newborn is the phrase due to, followed by Staphylococcus, and then aureus indented below that, which codes to P36.2, which you would then confirm in the tabular. You will see that though there is an instructional note under category P36 stating use additional codes if applicable to identify severe sepsis and any associated acute organ dysfunction. Neither of those conditions are documented by the physician. Therefore, the only code we need is P36.2. For the next example, a full-term male infant was born in this hospital by vaginal delivery with fetal alcohol syndrome. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is Z38.00, single live-born infant delivered vaginally. Remember, to locate this code, start at newborn in the alphabetic index, which has the words infant, live-born, and singleton in parentheses next to it, followed by born in hospital, which points to Z38.00, which you would then confirm in the tabular. The next code is Q86.0, fetal alcohol syndrome. To locate this code, you would start at syndrome in the alphabetic index, and then go to fetal, and then alcohol, which points to Q86.0, which you would then confirm in the tabular. For the last example, we have a diagnosis of premature crack baby born in the hospital via C-section to a mother dependent on cocaine. The newborn did not show signs of withdrawal. Birth weight of 1,247 grams, 31 completed weeks of gestation. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is Z38.01, single live-born infant delivered by cesarean. To locate this code, start at newborn in the alphabetic index, which has the words infant, live-born, and singleton in parentheses next to it, followed by born in hospital, and then by cesarean, which points to Z38.01, which you would then confirm in the tabular. The next code is P04.41, newborn suspected to be affected by maternal use of cocaine. If you go to the term crack baby in the alphabetic index, you are directed to P04.41, which you would then confirm in the tabular. The third code is P07.14, other low birth weight newborn, 1,000 to 1,249 grams. Remember that the guidelines state that when both weight and gestational age are documented, weight should be sequenced first. To locate this code, start at the term low in the alphabetic index. From there, go to birth weight, then with weight of, and finally 1,000 to 1,249 grams, which points to P07.14, which you would then confirm in the tabular. The last code is P07.34, preterm newborn, gestational age 31 completed weeks. To locate this code, start at premature in the alphabetic index, then newborn, and then less than 37 completed weeks, where there is a note stating C preterm, newborn. After following these directions, indented under preterm, then newborn is the phrase gestational age, followed by 31 completed weeks, which points to P07.34, which you would then confirm in the tabular. Now it's time for our quiz. Our first question is, true or false? Code P95 is for use when separate records are maintained for stillbirths. The second question is, true or false? The perinatal period is defined as birth through the 6th week following birth. The final question is, when coding the birth episode in a newborn record, assign a code from category blank as the principal diagnosis. You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is true. P95 is only used when an institution maintains separate records for stillbirths. Remember that no other code would be reported with P95, and it would not be used on the mother's record. The answer to the second question is false. Perinatal is before birth up until the 28th day following birth. The answer to the last question is, when coding the birth episode in a newborn record, a code from category Z38 is the principal diagnosis. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 16 of ICD-10-CM, Certain Conditions Originating in the Perinatal Period. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.